In children under 3, what is the most common hip disorder? Congenital hip dysplasia. What is the most common complication in infants with cleft palate? Otitis media. What position should we place a child with ascites? Semi-Fowler's position. When is the recommended age to start toilet training? Between 15 and 18 months. At what ages should the hepatitis B vaccine be administered? At birth, at 1 month, at 6 months. What are the classic signs and symptoms of pyloric stenosis? Palpable olive-sized mass, strong peristalsis from left to right during meals, projectile vomiting. At what age are wisdom teeth expected to appear? Between 17 and 21 years of age. What are the most common fractures in children? Green stick fractures. At what age do we expect the lower incisors to appear? 4 to 6 months of age. When is the optimal time for repair of a cleft palate? Before the child begins speaking. How do we communicate with a hearing impaired child? With gestures and body language. After surgical repair of an imperforate anus, in what position should we keep the infant? In the prone position. What do we mean by child neglect? Failure to provide a safe, secure environment for a child. What developmental milestones are expected in a 6-month-old child? Able to sit without support, object permanence. At what age do children begin to understand cause and effect? At 2 years of age. What is the primary purpose of play therapy for a child? To express feelings and frustrations. What are the 4 defects of tetralogy of Fallot? Ventricular septal defect, overriding aorta, pulmonic stenosis, right ventricular hypertrophy. What are the most serious complications of phenylketonuria? Brain damage, mental retardation. What is the most common chromosomal disorder? Down syndrome. What are the classic signs of children with Down syndrome? Slanted eyes, flat ears set low on the head, flattened face, small teeth, short arms and legs. What describes the stools in celiac disease? Fatty, foul-smelling. What is the recommended diet for a child with celiac disease? A gluten-free diet. What is the best food for infants up to 6 months of age? Breast milk. What is the difference between syrup of ipecac and tincture of ipecac? Tincture of ipecac is considered a poison and would cause death even with very small amounts. What is the difference between false labor and true labor? In true labor, there is a progressive effacement and dilation of the cervix. What is the complication from giving high levels of oxygen to a premature newborn? Blindness. How much weight gain is expected during pregnancy? 20 to 40 pounds. What does the term engagement mean? It occurs when the largest diameter of the fetal head has passed through the pelvic inlet. What does the term lightening mean? It is when the fetus descends into the pelvis in preparation for birth. What are the symptoms associated with lightening? Urinary frequency, increased backache, ability to breathe more easy. What does the term quickening mean? This is the first time the pregnant woman feels fetal movement. What does an APGAR score of 0 to 3 indicate? Severe distress. What does an APGAR score of 4 to 6 indicate? Moderate distress. In infants less than 1 year of age, why is it contraindicated to feed them with cow's milk? Because it's difficult for infants to digest. What are the positive signs of pregnancy? Ultrasound, fetal heart tones, fetal movement. What is Goodell's sign? Softening of the cervix. What is Hagar's sign? Softening of the lower uterine segment. How far in the pregnancy do we expect quickening? Between 16 and 19 weeks of gestation. What is the number one danger sign in pregnancy? Vaginal bleeding. What do we call painless bleeding during pregnancy? Placenta previa. What is the treatment for abruptio placenta? If the fetus is alive, prompt delivery by cesarean section. If the fetus is dead, vaginal delivery is preferred. What is Nagel's rule? Minus 3 months plus 7 days. Where do we expect the fundus at 12 weeks gestation? At the top of the symphysis pubis. Where do we expect the fundus at 20 weeks gestation? At the level of the umbilicus. What are the 3 phases of each uterine contraction? Increment, acme, decrement. What is the most ideal pelvic shape for delivery? Gynecoid pelvis. How do we measure frequency of uterine contractions? From the beginning of one contraction to the beginning of the next. How long after birth will heroin withdrawal symptoms appear in the newborn? Several hours to 4 days after birth.